The following video will provide a brief overview of the LifeVest wearable cardioverter defibrillator, also known as the LifeVest WCD or LifeVest, and includes information that will be important for you to consider in the event that you encounter patients wearing the device. LifeVest is a wearable defibrillator that offers at-risk patients protection against sudden cardiac death. Unlike an implantable cardioverter defibrillator, LifeVest is non-invasive and is worn outside the body rather than implanted inside the chest. LifeVest consists of two main components, a garment and a monitor. The garment is worn under clothing. It is designed to detect certain rapid life-threatening heart rhythms and deliver treatment shocks to the heart when necessary. The monitor is worn around the waist or from a shoulder strap. It is designed to monitor the heart, record arrhythmias, and determine when treatment is required. Electrodes are contained in the belt around the body. ECG electrodes continuously monitor the heart rhythm. Therapy pads deliver treatment shocks to the heart when necessary. On any given day, tens of thousands of patients have protection by wearing the LifeVest WCD. LifeVest is used for a wide range of patients, including those who have a reduced heart function following a heart attack, before or after bypass surgery or stent placement, or for those with cardiomyopathy or heart failure that places them at particular risk. Patients who have had an implantable defibrillator removed and are unable to be immediately re-implanted for whatever reason are also prescribed LifeVest for protection until the re-implantation procedure. The LifeVest system uses 4 ECG electrodes around the patient's body. One pair of electrodes provides a side-to-side channel of the ECG signal, and the other pair of electrodes provides a front-to-back channel. When a treatable ventricular arrhythmia is detected, LifeVest initiates a sequence of alerts and voice prompts to warn the patient and bystanders of a possible treatment shock. During this time, if the patient is conscious, they are instructed to press and hold the response buttons, which are found in the top corner of the LifeVest monitor. The response buttons prevent a treatment shock from being delivered. Please note that only the patient should press the response buttons. If, however, the patient is unconscious, the sequence will run through a 5-second vibration alert, followed by a low single-tone siren, which is broadcast for 5 seconds, followed by 5 seconds of loud 2-tone sirens. The device then transitions to voice prompts accompanying the 2-tone siren. In order to quickly and effectively care for a patient wearing the LifeVest WCD, it is important to understand the different alerts and voice prompts that may be broadcast from the device. If the LifeVest device is silent when you arrive on the scene, the device may be monitoring the patient's heart rhythm. If, however, you arrive on the scene and you hear a single-tone alert or a gong from the LifeVest WCD, the device may be alerting the patient to follow instructions displayed on the monitor screen. In some instances, the gong alert may also be accompanied by a voice prompt.
Treatment has been given. Call your doctor.
In these situations, you should proceed with standard evaluation and treatment measures. If external defibrillation is available, a decision can be made to remove LifeVest and monitor or treat the patient with your own external monitoring and defibrillation equipment. To disable the LifeVest WCD, simply pull out the battery. You can then unclasp the hooks at the front of the garment and remove the device. If you arrive on the scene and LifeVest is broadcasting alerts or voice prompts, it is important to pay close attention to these messages. Audible 2-tone siren alerts and voice prompts may indicate that the patient has been treated or is still in the process of being treated. You may hear the 2-tone siren alerts accompanied by this prompt.
If patient is not responsive, call for help. Perform CPR.
These prompts mean that LifeVest may be detecting an untreatable rhythm, such as asystole, is unable to detect an ECG signal, or may have delivered the maximum number of treatment shocks in a treatment sequence. In these situations, proceed with your standard evaluation and treatment measures. You may decide to disable and remove LifeVest and use your own monitoring and defibrillation equipment. Again, to disable the LifeVest WCD, simply pull out the battery, then unclasp the hooks at the front of the garment and remove the device. If LifeVest has detected a ventricular arrhythmia and is preparing to treat the patient, the two-tone siren alerts will be accompanied by this voice prompt.
Bystanders, do not interfere.
When LifeVest is in this mode, an electrical shock will usually be delivered between 25 and 60 seconds after the treatment sequence begins, depending on the type and rate of the arrhythmia and whether the patient presses and holds the response buttons. Please note that you can be shocked if you are touching the patient when the shock is delivered. Do not touch the patient when LifeVest is in this mode. Allow LifeVest to complete the treatment sequence and shock the patient. The device will broadcast when it has completed the treatment sequence. The sirens will stop, and you will hear the following instructions.
Treatment has been given. Call your doctor.
Blue gel on the patient's chest and back is an indication that the patient may have been treated. LifeVest deploys blue gel prior to delivering a treatment shock. The purpose of the gel is to improve shock conduction and minimize burning. This gel should remain on the patient as long as they continue to wear the LifeVest WCD. However, if you choose to remove LifeVest and monitor the patient with your external equipment, the gel can be removed using water. The LifeVest system is a wearable defibrillator that is designed to continuously monitor the heart rhythm, detect certain rapid life-threatening heart rhythms, and respond by defibrillating the heart back to a normal rhythm. If you are required to treat patients wearing LifeVest, pay close attention to any alerts or voice prompts that may be broadcast. And remember, you may proceed with standard evaluation and treatment measures as you deem necessary. ZOLL provides 24-hour technical support for patients and healthcare professionals. For any questions about LifeVest or dealing with LifeVest patients, please call us at 1-800-543-3267. You can also learn more about LifeVest by visiting www.zoll.com.